Welcome back to the channel where medical topics are made simple. Our videos give you memory tricks to help you out. Today you'll learn a simple way to remember the meaning and definition of nephrolithiasis versus urolithiasis versus ureterolithiasis versus renal calculi, which are all medical terms related to kidney stones. This video is a lesson from Chapter 5 of our Teach Me Medicine book, which will be linked down below, where you can find more information on this topic. Let's start with a quick recap of the urinary system, because this will help us understand all the different terminology. First, we have the kidneys. There are two of them, and they function to filter waste and fluid from the body to produce urine. They also help regulate blood pressure, and they're involved in electrolyte balance, acid-base balance, erythropoietin production, and vitamin D activation. Then we have the ureters. There is one on each side, and they extend from the kidneys to the bladder. They function to transport urine from each kidney down to the urinary bladder. This takes us to the bladder, which stores urine produced by the kidneys. Finally, we have the urethra, which is the final passageway for urine to exit the body from the bladder. Now that we understand the urinary system, let's talk about all the terminology for kidney stones, starting with nephrolithiasis. The simplest way to remember nephrolithiasis is to break down the word. We have nephro and we have lithiasis. Starting with nephro, this means kidney. The suffix lithiasis means stone. So if we put it together, we have kidney stone. And that's exactly what nephrolithiasis is. It's the medical term for kidney stone. More specifically, it's the formation of hard, pebble-like crystal deposits or stones within the kidneys. Now that we understand nephrolithiasis, let's move on to ureterolithiasis. In order to understand the term, we're again going to break down the word. We have uretero and we have lithiasis. Starting with uretero, this means ureter, and we already know the suffix lithiasis means stone. So if we put it together, we have ureter, stone, and that's exactly what ureterolithiasis is. It refers to stones in the ureter. Now let's move on to urolithiasis. What does this mean? We're going to break down the word again. We have uro and we have lithiasis. Starting with uro, this refers to the urinary tract, and we already know the suffix lithiasis means stone. So if we put it together, we have urinary tract stones, and that's what urolithiasis is. It refers to stones in any part of the urinary tract, including the kidneys, ureter, bladder, or urethra. Finally, we have renal calculi. What does this mean? We're going to break down the two words. We have renal and we have calculus. Starting with renal, this means kidney, and calculus means stone or pebble. So if we put it together, we have kidney stone, and that's what renal calculi are. It's another name for nephrolithiasis or kidney stones. Here's a quick summary. Nephrolithiasis and renal calculus refer to a stone that forms in the kidney. Ureterolithiasis is a stone in the ureter, and urolithiasis is a stone in any part of the urinary tract, including the kidney, ureter, bladder, or urethra. If you found the video useful, please hit that like button and leave a comment. Subscribe to save time studying and not miss out on future videos and notes. You can find all of our study guides, flashcards, and book linked down below. Thanks for watching and hope you return for future videos.